Hello friends, I am Dr. Rohini Ruhil. Today we will discuss about war and health. So friends, war has been a persistent and destructive force throughout human history. The relationship between war and health is complex and multifaceted. In recent decades, numerous conflicts around the world have underscored the critical importance of this issue of war and health. The Syrian civil war has resulted in a humanitarian crisis of unprecedented scale. Similarly, the conflict in Yemen has created one of the world's worst humanitarian crises. In the African continent, the conflict in South Sudan has led to severe food insecurity and displacement. The recent Russian invasion of Ukraine has brought renewed attention to the health impacts of war in Europe. Similarly, the Israel Gaza conflict highlights the devastating impact of armed conflict on the health and well being of civilian populations. These conflicts has resulted in substantial casualties and widespread destruction of healthcare infrastructure. So friends, as we explore the topic of war and health, it is essential to consider both the immediate and the long-term effects of conflict. Armed conflict results in significant loss of life, both combatants and civilians. The immediate aftermath of battles often sees high number of deaths due to gunshot wounds, explosions, and other forms of violence. Survivors may suffer from severe injuries such as amputations, burns, shrapnel wounds. The immediate medical response is often hampered by chaotic conditions of war zones. The breakdown of sanitation and public health systems can lead to outbreak of infectious diseases such as cholera, typhoid, respiratory infections. War conditions often exacerbate the spread of these infections. Conflicts can also lead to increased exposure to vector-borne diseases like malaria, dengue fever, especially in the regions where healthcare services are disrupted. Conflicts often disrupt food supplies, leading to acute malnutrition. The destruction of agricultural infrastructure and market can result in widespread famines. Prolonged sieges and blockages can lead to starvation among civilian populations, and this has severe and immediate health consequences. Now, the immediate psychological impact of war includes trauma, acute stress, and onset of post traumatic stress disorder. And this is among survivors, including both civilians and soldiers. And the immediate aftermath of conflict often sees a spike in the cases of anxiety, depression, and these are driven by loss, fear, instability. Now, survivors of war related injuries also face long term disabilities, requiring ongoing medical care and rehabilitation. Exposure to chemical agents, environmental toxins during conflicts. This can lead to long term health issues such as cancers, respiratory diseases. Many individuals continue to suffer from post traumatic stress disorder long after the conflict has ended, impacting their ability to function in everyday life. The prolonged stress and trauma associated with war can lead to chronic depression, affecting individuals' quality of life and productivity. Now, the long term rebuilding of healthcare infrastructure is a significant challenge. War often leaves hospitals and clinics destroyed or severely damaged. Conflicts often result in the displacement or death of healthcare professionals, leading to shortage of healthcare professionals also in the post-war period. Now, the economic disruption caused by war can lead to long-term poverty, unemployment, which in turn affect health outcomes. Poor socioeconomic conditions often lead to higher rates of diseases and lower life expectancy. Disruption of education during conflict has long-term health implications. Lower educational attainment is associated with poorer health outcomes and reduced access to healthcare services. Long-term displacement results in poor health outcomes for refugees and internally displaced persons, who often live in overcrowded and unsanitary conditions. Now, the health impacts of war can span generations, affecting the children and grandchildren of those who experience the conflict directly. Issues such as genetic damage from chemical exposures, and psychological impact of trauma can persist across generations. Conflicts often result in long-term environmental damage, such as contaminated water sources, destroyed ecosystems. These environmental changes have lasting health effects on populations. Destruction of farmland, destruction of agricultural infrastructure can lead to long-term food insecurity and malnutrition. Now, humanitarian aid and medical assistance are critical components in mitigating the devastating impact of war. However, delivering humanitarian aid during conflict is fraught with challenges. Restricted access to conflict zones due to military operation can impede aid delivery. The scarcity of medical supplies, scarcity of equipment, scarcity of personnel, trained personnel. This can hinder effective healthcare provision. Also, navigating complex political landscapes and adhering to international laws and regulations, this can pose significant obstacles. Now, healthcare in wartime also presents a unique set of ethical dilemmas that challenge medical professionals. Let's discuss some key ethical dilemmas faced in wartime. First ethical issue is triage and resource allocation. In war situations, healthcare providers must make difficult decisions about who receives treatment and who does not. The principle of triage prioritizes treatment based on severity of injuries and the likelihood of survival. However, this can conflict with the moral duty to treat all patients equally. Next ethical issue is of consent and autonomy. Obtaining informed consent in chaotic, high stress environments can be challenging. Respecting patient autonomy is a fundamental ethical principle. But in wartime, the urgency of medical intervention and the conditions of duress may limit the ability to ensure fully informed consent. Next ethical dilemma is public health versus individual care. Balancing the needs of individual patients with broader public health goals can be particularly challenging in conflict zones. For example, isolating infectious disease patients to prevent outbreaks may conflict with their need for comprehensive care. Public health ethics often emphasizes the greatest good for the greatest number, but this can sometimes result in reduced individual patient care and potential violation of individual rights. Next is that the psychological toll on healthcare providers working in conflict zones can lead to burnout, moral injury, and impaired decision making among healthcare providers. Supporting the mental health and well being of healthcare providers is crucial to maintaining the ethical standards of care, but this can be challenging in resource constrained environments. Now, the point is that the international humanitarian law plays a critical role in protecting individuals and minimizing suffering during armed conflicts. Efforts should be made to reaffirm and enforce the principle of medical neutrality, ensuring that the healthcare facility, healthcare personnel, patients, they are protected from attack and interference. However, the effectiveness of international humanitarian law can be compromised by non-compliance and the evolving nature of warfare. So, enhanced mechanisms for enforcing compliance, including stronger sanctions for violations and more effective international monitoring systems. Using diplomatic channels to advocate for the adherence to international humanitarian law, this is also important. Now, conflict resolution and peace building are essential processes aimed at addressing the root cause of conflict. Foster social inclusion by ensuring that all groups, including minorities and marginalized populations, have access to resources, political representation, and social services. Promote human rights education and awareness to build a culture of respect for human rights and dignity. Incorporate peace education into school curricula to teach children and youth about conflict resolution, tolerance, and the value of peace. Now, lastly, I would like to speak this verse from Dhammapada. Hatred does not cease by hatred, but only by love. This is the eternal rule. Thank you very much for watching. Bye bye.